Thank you very much. I think it must be some sort of a record now that we've gone about a month without talking about prostate cancer at the Grand Rounds. Just before I start, just a show of hands, who here uses sites like TripAdvisor or Yelp or Lonely Planet before they visit a city or an attraction or hotels, for example? Okay. And are you aware that we as physicians are being reviewed by similar sites in terms of our performance and the fact that patients, just like us, use it before they choose a physician? So I don't really have any disclosures other than to say that I do have a Twitter account. I'm not a Twitter expert, and I'm not doing this talk to try and boost my Twitter following. But for those of you that have a Twitter account, you may wish to tweet using the following hashtags. Now, if you don't have any idea what I just said, or the Twitter jargon, then hopefully by the end of this talk, you'll understand it. Alternatively, unfortunately, they're all not here today. But you may approach one of these guys. As you can see, they all have their prolific Twitter profiles up on there with hundreds of followers worldwide. So it's not a pseudoscience. Some objectives for today. We're going to provide an overview of electronic communication and healthcare delivery. We're then going to look at various aspects and modalities, different applications of social media. And we're also going to look at how it has evolved, specifically in urology. We all know that internet started during the 90s, and initially it was dominated by static content, i.e. web pages, published by individuals or groups. And since the turn of the century, because of increasing bandwidth, we now have more dynamic content, greater interaction and collaboration. Some have defined social media as applications that permit dissemination and sharing of user-generated or user-driven content. There are 6 sort of broad genres, if you like, of social media. Number 1 is content creation and publishing, traditionally in the form of blogs with the static content. Moving on to, these days, Twitter, or a form of microblogging where you have links to videos, pictures and so forth. Then there are the content sharing sites where individuals or groups can post videos or pictures such as YouTube or Instagram. Then there are the social networking sites such as Facebook or LinkedIn, aimed primarily not so much at the dissemination of information but at forging connections amongst users with similar mindsets. Then there are collaborative productions like Wikipedia or TripAdvisor or Yelp where everybody contributes and publishes their own reviews, if you like. Then the last 2 virtual worlds and add-ons are not so much relevant in terms of healthcare. The majority of US households, in fact 3/4 of US households reported some form of internet use, and most of them used a social networking site of some kind, and more than 40% use multiple sites. The majority of people that use social media use it for life updates. But interestingly, you can see here 50% of those that surveyed rely on social media as a source of news. Here's just some numbers showing the number of users for each application in terms of the scale of things compared to the population of, say, Canada or New Zealand. What else does it do? As Dr. McNeely alluded to earlier, allows a feeling of interconnectedness, rapid dissemination of information, and as we've seen, provided a seminal role in recent political events, as you can see there. Real-time dissemination and response. What about health information? Well, it also does the same a job, if you like. You've just put up a couple of examples here. The first on the left by Dr. Black, about him never getting tired of hearing Marty Gleave speak on new developments in precision oncology, with a photo of the classic prostate cancer timeline slide. And on the bottom right, the European Urology Twitter account tweeted in December last year some of their highlights, recommendations for the management of rare kidney cancers, and often with these tweets, it'll have a little pictorial with a link often to a free full-text article, so quite useful for educational purposes. We all know that communication is the fundamental aspect of medicine. And that's not just communication between physicians and patients, but between hospital admin, advocacy groups, society, foundations, pharmaceutical device companies. And electronic communication allows for more efficient communication and will allow for rapid dissemination, as I alluded to earlier. There's no doubt that the majority of patients want to communicate with their physicians electronically, improve access. However, surveys suggested that the uptake of physician-patient email communication has been slow. Some retrospective series published a while ago have looked at whether or not online consultations are a way to go. And not so surprisingly, they found that only in about 5% of cases were new diagnoses reached. And 90% of the time, however, treatment recommendations were made. You might ask, well, is this appropriate without the use of physical examination being all done in the virtual environment? It's debatable. However, the online consultation was certainly a bit more efficient when you compare that to traditional consultation. As such, several units have gone on to establish some e-visit programs. However, it's unclear whether this decreases the frequency of face-to-face or telephone encounters. Several older studies have shown that clinical interactions decreased after patients adopted electronic access. However, more recent data coming through now are saying that such ease of access may actually increase patient needs for clinical services as they become more information hungry. Nevertheless, the enthusiasm for direct messaging or ease of access to physicians is clear. There are some pitfalls and barriers to this, such as that around concerns about confidentiality, the accuracy of diagnosis and recommendation without examination. How about provider reimbursement for the time you spent online, electronically? And is there a disparity in delivery of healthcare for patients who may have not as easy an access to electronic means? So how does social media play a role in all this? Well, it allows integration of healthcare delivery with an emphasis on user collaboration, connectedness and openness, as some have defined it. There are an increasing number of examples of patients and physicians using social media and blogs to communicate. And some practices even have established secure and private social networks to facilitate that. In urology, major urological organizations such as AUA, EAU, or the major journals, so European Urology, Journal of Urology, New England Journal, BJUI, they all have gone to considerable efforts to increase their social media presence, and they all have dedicated committees sending out these tweets on a regular basis to disseminate information, educational material, guidelines, seminal information. And at conferences, particularly over the last sort of 5 years, we've seen an increasing use of social media, and I'll provide some examples shortly. There's no doubt that it's a cheap, quick way of disseminating information. And again, originally it was done via a blog way where it's sort of individual posts in chronological order, but with the increasing bandwidth and moving forward, different applications, this has changed. In 2006, approximately 12 million people in the US maintained a blog, and 57 million had read a blog. And when they looked at health-specific blogs, out of 1,000 influential blogs, the majority were created by women younger than 40 with doctoral degrees, and more than half were from a professional's perspective. About 40% were from a patient's perspective. But a lot of it focused on disease or disability experience rather than educational or research material. Then came along Twitter about 10 years ago, or just over 10 years ago, as a form of microblogging. It basically allows rapid posting of focused content, allows for speedy real-time communication and dissemination of information via smartphones, which we all have these days. So a bit of background, a bit of basics, Twitter 101. So each post that a user makes is otherwise known as a tweet. You're allowed up to 140 characters, so you have to be concise. There's no verbose paragraphs in there. And each user profile is identified by a Twitter handle, if you like, prefaced by an @ symbol. So some user profiles as an example up there. And so you go on, you create your own account, and then you can select to follow other accounts of interest. When you follow people, then your timeline becomes a continuous real-time stream of tweets generated by people that you follow or by yourself in a reverse sort of chronological order. You can reply to or share someone else's tweets, otherwise known as a retweet, and this usually signifies that you endorse or support their comment. You can tweet directly at other users by mentioning their Twitter handles, and you may also wish to include hashtags, which serves as keyword purposes to, allow indexing of your tweet so that when other users search for it, it becomes easily accessible. So if you want to tweet about the meeting that you're attending, AUA 2017, that's the hashtag you use. And if you want to search all the tweets that are tweeted during the meeting, simply put in the hashtag and away you go. Tweets can also be favorited or liked by other users, which typically, as I mentioned earlier, signifies agreement or positive feedback. So here are some more examples. Dr. Black features heavily in this talk, as you can see. So top left is a tweet that Dr. Chu put out. So he's retweeting, meaning he supports it or endorses it. A tweet from Talking Urology, which is a sort of podcast group from Australia. A couple of Australian urologists made this. But essentially, Peter Black discussing rapidly changing landscapes of bladder cancer, and again with a link to a video. So educational, being retweeted. And on the bottom right, a European Urology again tweets about some more guidelines on treatment of first-line metastatic clear cell renal cell carcinoma, again with a link to a full text free article. There's no doubt that Twitter allows for dissemination of novel research and breaking news in urology in a rapid fashion, allows for streamlining of professional networks, and others have created online forums through Twitter, such as the iUrolJC, so that's International Urology Journal Club. It also allows connecting attendees at large conferences. I briefly mentioned the online journal club. So a lot of urologists disseminate new seminal research journal articles through Twitter. It allows for rapid fire response. As an example, there was an article published in Science not too long ago, which was put on Twitter and quickly and resoundingly criticized via Twitter. Subsequently led to an expression of concern a week later by the same journal. And as Dr. McNeely mentioned earlier, there's good evidence showing that the frequency at which an article is tweeted correlates pretty closely on how often it'll be cited ultimately in the literature. So some more examples. So we all remember the day when US Preventive Services Task Force issued statements against PSA screening. So there was a notable spike in tweets related to prostate cancer and PSA within 24 hours of that release. And briefly, International Urology Journal Club in 1 year attracted participation for nearly 200 users from 19 countries and has input from readers, reviewers, and authors. So recommended for residents. And I used this when I was training a while ago as well. What about at conferences? So Twitter use, as I mentioned earlier, has increased year on year at all major urological conferences, AUA, EAU, GU, ASCO. In 2014, at the EAU, almost 6,000 tweets were sent by 800 participants. And when they surveyed AUA members, over a third of the responders there had a social media account and used Twitter. Here is a result of that survey. On the top, you'll see the type of social media accounts people had, and almost everybody had a Facebook account, as you can see here. And some had LinkedIn, others, over a third, had Twitter. On the bottom, it showed how they used social media, and the majority of people who had social media accounts used it for personal reasons, like most of us. Some would use it for business or personal, and very few use it for business only. Then there's the question of professional conduct. Are there concerns about professional conduct through social media, especially on Twitter? Well, evaluation of 260 physicians who had at least 500 followers, like Dr. Black and Dr. Goldenberg, as you saw earlier, show that these events were quite rare, less than 3% of observed tweets. And most unprofessional tweets involved privacy violations or use of profanity. Then we move on to video content sharing, such as that on YouTube, again created about 10 years ago. And as we sit here over the next hour, about 6,000 hours of content will be uploaded. Right. Users can then search, browse, or subscribe to other people's channels to view the content. However, the social interaction on this platform is limited to comments below each individual video. There's no doubt that patients use this for health-related information. There are some descriptions of conditions, procedures, experience from other patients, etc. on this. However, there's no peer review through this process. The information can be inconsistent, biased, or even uninformative sometimes. An evaluation of 51 YouTube videos published in the Urology journal on PSA testing and treatment of prostate cancer showed that, in fact, 3/4 of the content was deemed only fairly or poorly informative. Content related to PSA testing often tend to guide patients toward one treatment modality or the other. An article published in JCO looked at YouTube videos posted by dedicated robotic practices. They were much less likely to mention other treatment alternatives compared to those that were published in the university cancer centers or general hospital systems. A recent systematic review on medical information on YouTube showed that a significant amount of it was anecdotal. However, content uploaded by professional organizations or government agencies were more likely to be of higher quality, but can be harder to find for the patients using typical search terms. Then there are the pharmaceutical third parties using it for advertisement purposes as well. So apart from patient information, YouTube can also play an educational role for healthcare providers, physicians, students, residents. There's lots of surgical videos on specific details, steps, techniques published by well-known organizations or physicians. Such as that of Bladder Cancer Canada, you can see on there. They've got 90 videos, and often patients are directed to that for additional information. Can be a useful adjunct, but not a primary source of medical education. Moving on to social networking sites such as Facebook or LinkedIn. Unlike content sharing, these are centered around building connections or networks. These allow individuals to construct a public or semi-public profile within a system and then articulate a list of other users with whom they share a connection or similar goals or interests, and then view and traverse other people's list of connections and those made by within the system. They have an important role for patients and physicians in management of health-related concerns. Patients can use it to talk and meet other patients with similar diagnoses and collaborate on disease management and provide social support. Facebook is the most commonly used social media application. Over 2 billion users use it. And in that same survey you saw before, 3/4 of urologists were social media users, and almost everybody had a Facebook profile. However, most people use it for personal use only. And a survey by Nature in 2014 showed that scientists were significantly more likely to use Twitter or LinkedIn in a professional manner versus Facebook. There are some people who use Facebook for medical reasons, and it has been shown to be beneficial. So at-risk individuals randomized to Facebook-mediated information about home HIV testing showed that they're more likely to obtain and use their testing kits compared to the control group. But the reliability and the usefulness of information available on Facebook is less clear. As an example, for urinary incontinence, only 13% of the content on here is deemed informative. Most are either touting their commercial products as an advertisement or doesn't contain any real usable information. What about direct physician-to-patient communication through Facebook? Again, privacy concerns come up. As such, the American Medical Association recommends against any of these interactions. One has to be aware that it is a public arena, and the digital footprint that one leaves on these sites are permanent. So the US government have come up with this Health Insurance Portability and Accountability Act to try and standardize, set some rules in terms of how one should approach social media when it comes to healthcare. And there's a Canadian equivalent as well, the Personal Information Protection and Electronic Documents Act. There are multiple publicized cases of physicians violating this act with inappropriate Facebook posts of patient information. And this is even when specific patient names, numbers, and details have not been published, but one can still violate confidentiality. And the study of Facebook use amongst residents or medical students at academic institutions identified multiple examples of publicly accessible profanity, sexist commentary, racially charged content. So one has to be careful. In terms of LinkedIn, created a little more than a decade ago. It's ideally aimed at professionally orientated social networking. Allows individuals or practices to create a LinkedIn profile to connect with other users to make them more successful. And over 300 million users use it over 200 countries. And about 50% of AUA members who were surveyed in that survey you saw earlier who use the social media have a LinkedIn profile. So what does it do? Well, it ranks highly in its ability to improve one's online reputation. Essentially, it creates an online CV for physicians. You can add your employment and educational history, professional memberships, links to selected publications that you've been involved with. And what happens then is when someone searches for your name on Google, if you have a LinkedIn account that's well populated and well reviewed, that can come up in that first page, i.e., increase your personal branding, if you like. Then we have the physician review websites, which I alluded to earlier in the talk, which allow users to give feedback on customer experiences. Now, these physician review websites are not created by physicians, so you don't go and create your own profile. Your patients would have done that for you. And then they go on and review their experiences. These incorporates elements of social networking as well. So users who leave reviews have to generate a profile before they leave a review, and then their comments and ratings are subsequently catalogued. Just got an example here of Dr. Alan So's profile. Again, it's not created by Alan, but you can see that he's male. He works at UBC and VGH. He's a urologist. This is where he practices, and in the 59 reviews he's had, he has attracted 4.5 out of 5 stars, so not so bad. In a survey published in JAMA in 2014, showed that nearly a quarter of patients relied on physician rating websites when they go out and choose a physician, much like you when you choose a restaurant. 60% of the 2,000 patients thought that it was somewhat or very important that their physician had a decent rating, whatever that may be, when making a decision. You might say, well, there's obvious bias here. Only 3 to 5% of patients who you see end up leaving a rating, and we all know that those who take the trouble of going on and leaving a rating will probably leave some sort of negative comment, but that's not really the case. When they looked at these rating websites, revealed that only 6% of reviews were negative, and it didn't really vary between whether it's a review about a specialist or about a family doctor. So then, recognizing all the pitfalls, are there any guidelines about how one should approach social media? Well, the EAU and the AUA both have recommendations for appropriate social media use in the urological community. And basically the principles are the same. One should protect patient confidentiality, acknowledge that all social media content is permanent and potentially public. You have to maintain professional conduct and refrain from self-promotion. Moving forward, I think we need to be aware that this exists and this will only expand as we go through. We need to take control of our social media presence as a next step. They'll have a greater role in urology and overall healthcare delivery. And I think there's no doubt that patients are doing their research, whether we like it or not. And I think it's our job to either provide them with or direct them to appropriate sources of information out there. It'll become more pervasive with time and more individuals will become adept in its use. And integration of social media into our practice will also need to increase. We need to better understand what the patient and the community needs and provide a safe, secure platform to disseminate information. We need to facilitate patient and medical education as well as communication between providers and patients. We need to also streamline this communication process across social media that is compliant with the acts that we talked about earlier. But as we move through with new applications, privacy and professionalism concerns will continue to evolve and will need to be addressed before the power of social media can be fully utilized to improve the delivery of healthcare. I believe we can, and I think we need to. That's all I have. Thank you.